As many seniors age, a common unknown occurrence that often gets misdiagnosed is spine fractures. These spine fractures often go untreated, and many patients self-diagnose them as back pain problems. Through our investigative reporting, we discovered that these spine fractures can be treated and that patients do not have to live in pain and can live a much more active lifestyle. Dr. Beall, located in Edmond, Oklahoma at Spine Fracture Institute, utilizing a minimally invasive procedure that's saving lives and helping patients live a longer life.
Spine fractures are exceedingly common. There's about 750,000 per year. You'd find that about 1 in 7 people have fractures. And the vast majority of these people will be asymptomatic. They won't know that they will have fractures. They will have fractures that are not painful. The other component and the cognitive dissonance of this is there are some fractures that are incredibly painful. If you have some fractures that let's say it presented with a 7 out of 10 pain or more, if the patient has pain and it's moderate to severe, especially moderate to severe and increasing, they need to be treated. And if patients has low pain or pain that's improving, perhaps they don't need to be treated.
We discovered that these injuries often go unchecked and can be easily missed on an X-ray. Close to 65% of all fractured spines are missed on X-ray and occasionally missed on MRIs. Many people with this injury suffer in silence, feel they are stuck with severe back pain, and that nothing can be done. Many times, general practitioners prescribe pain medication and bracing, not knowing how to properly treat the patient.
We often get calls from family members just looking for a solution. They will say that my mother has a severe back pain, and so we investigate a little further, finding out that they might be in that typical age range, over 65, with severe onset of back pain that is not normal in an older adult. Often the patients will have seen different types of physicians. Their primary care, they might see an orthopedic surgeon, they might see a neurosurgeon, and they're told that there's not anything that they can do. Without the education and knowledge that these fractures will not heal in an older adult, the patient will just then go home and rest, and the longer they lay in bed, the more loss of bone density that they get, the more fragile they become. So the patients then will lie there in bed and have issues with pneumonia, pulmonary embolism, and even heart attacks and death, waiting to have a solution to their pain.
When we visited the Spine Fracture Institute, saw the surgery, interviewed the comprehensive staff, we learned the patients that suffer with spine fractures can be treated quickly and have a life-changing experience. The procedure is called Kyphoplasty. The surgery only takes 20 to 30 minutes, and the recovery time is only 30 minutes to an hour. Then, the patient is ready to come home. Patients that couldn't walk because of severe pain or were bedridden have the ability to walk in a short period of time after the surgery.
This procedure, although it's been extant for a little right around 20 years, has consistent improvements in technique, consistent improvements in the materials, consistent improvements in introducing new technologies such as implants. And in fact, our site was the single best site and significantly better than the other 23 sites in terms of improving patients' pain and increasing their function. So the response, the typical average response, is a very dramatic response to kyphoplasty. The patients tend to be tremendously satisfied. We get them out of their downward spiral deconditioning. We get them back up and around. We get them moving again so they don't die of deconditioning.
When we reviewed the patient information, we discovered the Spine Fracture Institute has demonstrated superior results and has an amazing track record. Dr. Beall and the Spine Fracture Institute has had a near 100% success rate in recovery with life-changing results. The procedure often changes the lives of loved ones and family, knowing that the one they care for doesn't have to suffer anymore.
A doctor picked it up on an x-ray that I had cracked vertebrae because I didn't know what it was, but I couldn't walk. And so at the time that I was in contact with the folks here, they immediately got me in on a Monday, and they had to literally wheel me in a wheelchair because I couldn't walk. And they started the procedure about 9 o'clock in the morning, and by 3 o'clock I woke woke up and I could walk. And it was just absolutely amazing, the difference.
I've probably pre-oped hundreds of Dr. Beall's kyphoplasties before my own mother herself had a fracture. I noticed she was having lots of increased pain in her back, difficulty breathing, and just not herself. So talked her into coming down and having a scan, and she was fractured. Amazingly, after it was over, she was ready to bounce back. She was back walking like she was, going shopping like she was. Everything was back to normal after she was fixed, after her fracture was fixed.
My daughter had just started working for Dr. Beall, so she insisted that I come down here. I thought I had pulled my back. I picked up a heavy object, and then after I had the procedure done, it was immediate relief. I mean, I walked out of here. I didn't even want the wheelchair.
This important procedure changes lives in a monumental way and also saves lives. A patient that was once bedridden or hindered by tremendous pain can now walk and live pain-free.